Sounding guy, this is Sama from Yanzus, and today we will discuss about the scalp, temple, and face. So basically, starting from the scalp, here we have this is a British Jurassic book. So we will study about scalp. Okay, what is scalp? ठीक है, anteriorly from anteriorly supraorbital margins and posteriorly external occipital protuberance and superior nuchal line on each side of the superior temporal line. Structure. So as far as scalp is concerned, there are 5 layers. The scalp has 5 layers. So we use mnemonic scalp. For scalp, we use mnemonic scalp. First is scalp. First is skin, second connective tissue, third aponeurosis, fourth loose alveolar tissue, and fifth pericranium. So here this is written skin, superficial fascia, yani it means connective tissue, containing connective tissue, and okay, and deep fascia in the form of epicarinal aponeurosis are gallia aponeurotica with occipitalis frontalis muscle, loose alveolar tissue, and pericranium. So these are 5 layers of scalp. These are important to remember. So here this is diagram of scalp layers. Okay, here you are seeing this is skin with hair, then superficial fascia with blood vessel, then apical aponeurosis, then loose alveolar connective tissue. This is this pink line, loose alveolar connective tissue, then beneath is pericranium. So you are saying here emissary veins running and diploic in between outer and inner tables. We shall study about diploic bones in skull here. So so this was a major overview of scalp. Okay, now we shall move towards the arterial supply of scalp and superficial temporal region. Basically, scalp is supplied by the following 5 major arteries: supratrochlear, supraorbital, superficial temporal arteries, posterior auricular occipital arteries, both of which are branches of external carotid artery. So basically 2 arteries, 2 main arteries are involved, which are internal carotid and external carotid. Both of these then gives branches together, they become 5 branches. So internal carotid artery gives 2 branches, supratrochlear and supraorbital, and external carotid artery gives 3 branches, superficial temporal arteries, posterior auricular occipital, tortuous arteries, both of which are branches of external carotid artery, I have told you earlier. So if we see in diagram, so here this is supratrochlear artery and this is supraorbital artery. Okay, then here is superficial temporal artery, this is posterior auricular artery, as this is behind the ear, so this is posterior auricular artery, and this is occipital artery as it is near to the occipital protuberance. So these are easy to remember. So basically first 2 are branches of internal carotid artery. ठीक है, from internal carotid artery there arises ophthalmic artery, and then this gives supratrochlear and supraorbital artery, and last 3 superficial temporal artery, posterior auricular and occipital artery are branches of external carotid artery. Okay, so now we will see its venous drainage.